All right, so we'll probably go ahead and get started. My name is Annie. I'm a pharmacist. I'm the clinical director here at Atrium. You've probably seen me before if you've tuned into our webinars over the past year. So today we're going to go through all things liraglutide. So a basic introduction into the medication itself, dosing and administration, comparison with other common GLP-1s, patient selection, liraglutide in combination with some of the newer medications, compounding considerations, workflow integration into your pharmacy, how to market it, and then our GPO offerings as well. So what is liraglutide? So it is a GLP-1. It is one of the newer ones. So it was the first one approved for weight loss. So it does have type 2 diabetes and weight loss approval. So the weight management approval is under the brand name Saxenda, and then of course Victoza for diabetes. So it is a subcutaneous injection like the other ones. It is daily dosing, which does stand out from the others, but we'll compare them a little bit more later on. The standard titration is from 0.6 to 3 milligrams. In general, the 0.6 milligrams isn't considered a therapeutic dose. It's more so used for mitigating side effects. So it helps the patients get used to the medications, and then they'll bump up in a week or two to 1.2 milligrams. From there, they'll go up to 1.8. That is the last approved dose for diabetes. But for weight loss, it goes all the way up to 3 milligrams. So they would go to the 2.4 and then 3. I do think the 3 milligrams is going to be the most common dosing that we're going to see in general, since the titration does go up so quickly. Patients on maintenance will probably be around there, especially since the efficacy of liraglutide is not as much as the others. So we did speak about the daily versus weekly injection, which is a little bit of a downfall for patients, but what is great is you get to supply them with the medication. So they have it at home, so they can do those daily injections. So in clinical trials, they've seen about 5 to 10% mean body weight reduction versus the 15 to 20% plus that we've seen with the newer ones like semaglutide and tirzepatide. But one of the main benefits is that the side effects are often a lot milder. So patients see less constipation, less severe nausea, which can be really big for a lot of patients. So who is a good candidate? So I think anybody who is starting off who's never been on a GLP-1 is a good candidate for liraglutide. Patients who have tried semaglutide or tirzepatide in the past and weren't really able to stick with it due to the side effects, this is a great option for them. Patients who have gone through their semaglutide and tirzepatide therapy and they're kind of where they want to be at maintenance, I see this as a good option for them too, instead of just completely cutting it out. I think this will help them either taper down or just stay at a maintenance dose. I think it is important to set realistic expectations with these patients and expected timelines for them as well. Let them know, you're starting at a 0.6 milligram dose, and maybe they're going to be discouraged if you don't counsel them that they're not feeling, a big part of appetite suppression or things like that. But if they know, hey, this is a dose to get you started off, to help with side effects, then it will bump up, every 1 to 2 weeks. Then I think patients will be a lot more open to it. I also think there's a lot of benefits to less appetite suppression. So semaglutide and tirzepatide can be amazing for so many patients, but sometimes patients aren't able to make the best food choices because they are feeling so nauseous. So I do think when you see less appetite suppression, patients are able to make better food choices. They're able to get their protein in. They're able to maintain more muscle mass, and really extreme weight loss really fast is actually not very healthy for people in general. And I think a lot more clinics and especially ones that are focused on health and wellness are realizing that. That's why you'll see a lot of microdosing going on. So I think a lot of people will be interested in this because maybe they're realizing, oh, I lost all of my facial fat, and now it's aging me, et cetera, et cetera. I think there are a lot of benefits of not having quite the extent of appetite suppression that patients see with the others. I would always counsel patients, and I do, to take it as slow as possible. So the patients that want to jump up every week on tirzepatide and they want to jump up to 15 milligrams, I always try to back them off of that. And I do think you see better results long term with being able to keep the weight off as well. Another thing I think we're going to see more often is liraglutide in combination with some of the, they're not really new, but I'm calling them newer wellness injections because they've just gained popularity recently. So a lot of clinics have been using these in conjunction with GLPs for a long time, but a lot of the times, they'll just inject sermorelin once a week because that's when patients were coming in for their GLP injection, but it's not really a therapeutic dose. So having the patients at home with the medications is going to be a huge benefit. So I think we're going to see more people using it in combination too, to also bump up that efficacy. So specifically with sermorelin, it can help with fat loss and body composition, which is really important, as I'm sure everyone has seen with the GLPs. MIC also helps with energy production, and fat management as well. B2, B12 for energy, and then NAD for all kinds of good stuff, but a lot of anti-aging benefits as well, which is one of the main implications people are seeing from the GLPs. So, of course, there's been a lot of talk recently about semaglutide and tirzepatide since they've come off of the shortage list. And people are wondering, well, can we legally compound liraglutide? And yes, it is currently on the FDA drug shortages list. And it is interesting if you look on the website for the specific reason for each medication. The Saxenda, which is the one approved for weight management, is on the shortage list because of an increase in demand of the medication. So you can kind of get an idea that people are starting to look towards this. It may not have been a blockbuster when it came out, but now that more people are aware of the GLPs, they are starting to increase interest in it for sure. Okay, so now we'll talk about, all right, we like the idea of liraglutide, but how do we get started with it in our pharmacy? And I'm sure many of you have already implemented semaglutide and tirzepatide, and maybe you're looking towards what's next, what's going to replace this, how do we service our patients for it? But if not, and you're new to this whole pathway, you can purchase liraglutide from 503Bs and then sell them pursuant to prescriptions. So like for our process, if you were to go to our website and then into our GPO page, it will show our GPO partners. So it'll show Olympia, it will show PQ, who both have liraglutide coming out soon. And you would click to register. They'll take down all of your pharmacy information. Once your account is activated, then you'll be ready to order. Through our GPO too, we have already negotiated big group discounts for you. So you're getting a discount that huge places that are doing mass volumes would get, but you wouldn't be able to get on your own unless you were aggregating the purchasing power, which we're able to do with our independent pharmacies. So that is really useful. But once you are registered and you have your account set up, you just order from them like you would order from a wholesaler with your normal medications. You will have it in store on your shelf or ready to dispense, and then you just dispense it pursuant to a prescription. They will have an NDC number and everything, so you can add it into your computer system. And that's pretty much it. So a lot of people are asking, should we offer liraglutide since the efficacy isn't as great as semaglutide or tirzepatide? And I think absolutely you need to. If you've done it before, I think you need to keep those lines of communication open with prescribers. And if you haven't, now is a great time to jump in. It's important for sure to maintain the relationships that you have already built. That's going to be important when we're looking towards the future. if you look at the GLP pipeline for clinical trials, it is incredible. Of course, the one probably most people are talking about is the retatrutide, which the results of phase 3 trials should come out the end of 2025. So we could be seeing that on the market as soon as the first quarter of 2026, which really right now is right around the corner. So it's best to have the process built and the relationships built now, even if you don't take off with liraglutide, you have that system in place to set up everything that you're going to need when the next big thing comes. And, I know people are already seeing disruptions in the production line for semaglutide products as well. So you never know when something is going to jump back on the shortage list. You want to be ready to go. And I don't think this pathway, even outside of GLPs, is going to stop. I think this has opened up a whole new service pathway for pharmacies and patients where you can get them really good quality medications from somewhere that they trust. So there's a lot of reasons why I think it is important to offer it. And it's a good piece when you're talking with your prescribers as well. If you have a rep or if you are the one who follows up with your clinics or you have a technician who does it or anything, a lot of times people will feel uncomfortable, like, I don't want to come back to them and just say, hey, how's it going? I don't want to bother them. But this is a great opportunity to come to these clinics and say, hey, here's this new thing that we offer. I want to let you know that we have it. Here it is. Here's the pricing. Here's the process, everything. So it's a great way to get in the door or to just follow up and keep those relationships alive. So we have a full program available within Dotti. This one is great because it is included with all memberships. So even at the basic membership, you will get all of the liraglutide materials. So we have patient information sheets, prescriber cell sheets, bag stuffers, RX order forms, and the RX order forms are specific to 503Bs that are in our GPO. So right now we have Olympia's loaded. So it will have exactly their concentration, their suggested dosing on there. So it really takes the step of you having to figure that out yourself with being busy with everything else you're doing in the pharmacy. Those resources are also auto-branded when you download them. And then we have a ton of resources as well that are available to all memberships surrounding GLPs. So things like injection instructions, subcutaneous site information will all be able to just be pulled and used with liraglutide as well. So there is a plethora of information inside Dotti. And another really good resource we now have is a telemedicine platform within our GPO, ExpediCare. So they were created specifically for independent pharmacies. And it's a great offering for you to have in your pharmacy because you can compete with the online telehealths that have become so huge. Patients are turning to these companies in record numbers. As you can see, there's many billion-dollar companies that have popped up over the last couple of years. So just take that into consideration. Like, you can see where the industry trends are going by looking at these companies. So they're all going to be doing the GLPs, and then they have the other injections as well, the sermorelin, the NAD, which we also have included in our GPO, along with marketing materials behind those as well. The telemedicine also really allows you to market directly to patients, which is great. Sometimes there's a disconnect between a patient wanting something and then having to bring that to their prescriber and explain what it is. And a lot of typical prescribers don't understand these compounded medications, especially the newer wellness injections. So they don't really feel comfortable prescribing it. And then the patient just kind of gets stuck. And then the next thing they're going to do is, well, I'll just order it online. But of course, they want to come to you first, someone who they know, someone who they trust, that they're going to get a good quality product from. So that allows you to really compete with that huge healthcare business. Another really important piece, I think, to consider when you're going out even to like the, let's say, wellness clinics, with their semaglutide and tirzepatide, maybe if you had a rep approach them before they say like, no, we actually order from a 503B ourselves, and we just inject patients in-house. And, they were making a ton of money off of that. So they didn't want to send prescriptions to you to fulfill it for them. But with this, they may still want to offer liraglutide to their patients because they don't want to cut them off either in terms of GLPs. But they need a fulfillment partner for them since it is a daily injection. They're not going to be going into the clinic every day. So this is a really good opportunity to partner with clinics that may have even said no before, but might now be open to partnering with you because they need somebody as that middleman to get the end product to the patient for daily use. And then, of course, social media marketing is so big these days. So that's great. You can promote the medication itself, the new therapies that are out there, and then also the telemedicine option that you have. And I know a lot of people get stuck on knowing, well, like, I'm running out of things to post, or what do I post? So another great thing that our digital marketer and I have talked about before is you can always just pull information from these resources that we have created for you. You can pull a snippet at a time, and you can have a post a day, a couple posts a week, just using the information from those as you start to grow your business. All right, so then I'm going to review quickly the offerings that are coming out from our 503B partners. So Olympia is releasing their liraglutide on 6/11. So that is coming up quickly. So their beyond use date is expected to be 90 days when they release it, but they will extend it to 180 days. And they're going to offer a 6 milligram per ml concentration in 2 different vial sizes, so a 5 ml and a 10 ml. So you got 30 milligrams or 60 milligrams total. What I do appreciate about Olympia as well is that if you want to get started with something like this, there's not really a downfall, and there's not really any risk to it, because with Olympia, you can order 1 vial at a time. So let's say, all right, I'll start letting people know, but the first week I only got 2 orders in. You can order just those 2 vials. That's not a problem. So that makes it really easy for pharmacies who are really just starting off. And as you see, you'll grow and you'll get a lot more orders, but it can be intimidating. You don't want to lose any money in the process. But with this, it's just guaranteed profit, no matter what. And then we have PQ, and they are releasing their liraglutide in mid-July. So their beyond use date is expected to be 180 days when it comes out, and then they will push that as well. So they have 3 different vials. They're going to have a 6 milligram per ml 5 ml vial, and then a 15 milligram per ml 3 ml, and a 15 milligram per ml 6 ml. I do think that the 90 milligram vial is going to be the most popular one. As I mentioned before, I do expect patients to jump up to that 3 milligram dose based on the clinical efficacy that we've seen. Even if patients are taking it slower, there's not as many doses to get through, and the efficacy isn't as much as we've seen with the others. So that's just clinically what I'm expecting to see. That is the typical weight loss dosing of Saxenda. So I'm really excited about that 90 milligram vial. And that's pretty much it for the presentation here. But I'm going to see if I have some questions coming in. Okay, so someone's asking, are clinics able to dispense from office? So clinics could do this in office for sure. So they could order from the 503Bs and inject the patients themselves. So the office use ordering, which has been around for so long. But I don't see it happening because patients would have to go in every day unless the clinic had its own dispensing license and then was dispensing it pursuant to their own prescriptions. But that's where I see this really big opportunity for our pharmacies with clinics that weren't interested before. What are we thinking as far as converting people over? Not starting at 0.6. No, I would not start anybody who is transitioning. Of course, this will be up to their prescriber, but you'll be able to help and support them in that as well. But anyone who is on a GLP and is transitioning, or anyone who even has probably been on it in the last couple of months, I don't think the 0.6 is necessary at all. So the lowest I would start anyone who's on it now or been on it in the last couple of months would be the 1.2, with potentially to bump them up even faster than the typical titration. I do think that they're going to need to be on the higher doses. I'm thinking most people who are converting over are going to be at the 3 milligrams. Is there a way to know how long liraglutide will be on the shortage list? I don't know that answer. There still are several variations of it that are in shortage, specifically Saxenda, due to the increase in demand. But there are some of the generic liraglutide ones on back order as well, the diabetic dosing specific ones. So it's hard to tell. And I understand what she's saying here. She's skeptical of adding this only to last a few months. I do think if you are planning to get into this space at all, you do have to just go in. There's not really, you don't have to put a lot up for it. It's not like you're building out anything new. You're utilizing the infrastructure of your own pharmacy. You're just offering something to your patients that they can't get right now. So I don't see any downfalls of it, besides patients having something and then not having something. But I think there's always going to be an option of what can we help them with, what can we transition them to, what's available now. So I do think it's important to dive in with what's available now. And then, as I said before, things are always going to change. The earliest patents for Ozempic are expiring in 2026. So I don't know what that will look like legally because it's so complicated. There are so many different patents associated with each medication, but that could potentially throw things as well if things start to go generic at all. I don't know if that first patent expiring will push that into it or if it's going to be extended. But I do think there's always going to be something that is going to either be on back order, or maybe Atrium's going to be in the forefront of helping you offer something new. So we are always staying on top of what's happening for our pharmacies, communicating with manufacturers, communicating with lawyers, communicating with the 503Bs. So I do think that there's always going to be something there that we're going to be able to help you out with. And even just putting your foot in the door, let's say I'm a little nervous about just doing liraglutide. We'll start doing liraglutide with sermorelin and NAD, and you'll see it's not such a big deal because you're not starting a whole new thing. It's all the same process. And you can really break out into what your pharmacy is offering and your patient reach. You can instead extend who you're able to reach with if you're doing telemedicine or just patients who are looking for it in your area. There's a lot of places that are more rural that don't really have these wellness clinics or specific anti-aging clinics, and you can be on the forefront of that. I would also say it's a lot easier to get out in front of it. If you said, I'm not going to do liraglutide now, maybe I'll wait and see what happens with the market. The problem with that also tends to be, well, there's going to be somebody else who is. So it's a lot harder to switch patients or prescribers once they already have something implemented. So even if you're like, well, we have a better product, we have this, it's difficult for a business to change how they're already doing something unless they're having an issue. So being that one first out there with it, I think is a huge benefit. That was it for our questions. So thank you guys for joining me today. You can reach out to us if you have any questions at hello@atrium24.io. We'll be excited to hear from you all and see what we can help you with as you grow your pharmacy. Bye.